is Julia Henry, and today we'll be looking at health disparities of infant mortality rates between non-Hispanic blacks and non-Hispanic whites. First, I'll talk about what infant mortality is and why it's important. I'll go into what other disparities exist and talk more about the African American population and how infant mortality affects this group. I'll end the presentation with some possible causes and explanations as to why this disparity exists. Before we begin, we need to know what a health disparity is. Lydia Isaac investigated the many definitions of health disparities, disparity meaning difference. One of the definitions Isaac references comes from the Minority Health and Health Disparities Research and Education Act. To paraphrase, a health disparity population shows a significant disparity in the overall rates of disease incidence, prevalence, morbidity, and mortality compared to the general population. An infant is a baby under 1 year of age. The infant mortality rate is the number of infant deaths per 1,000 live births. Rates of infant mortality are important because it measures the health of a nation. Do they have access to health care? Do those who live in poverty have adequate resources and income to counteract the effects of poverty? Are citizens provided environments that promote physical and mental health? Let's now look at some disparities of infant mortality rates. First, note that infants of any race or ethnicity face a higher risk of infant mortality if they are born in poverty. However, babies who are African American, Puerto Rican, American Indian, and Alaskan Native often die in the first year of life. There are 5 leading causes of infant mortality that together make up 57% of all infant deaths. If we take a look at preterm related deaths, African Americans have rates 3 times higher than whites. Overall, non-Hispanic black women have the highest infant mortality rate at 13.4 compared to white women at 5.5. African Americans have a high number of preterm related mortality rates, but babies who are born with a normal birth weight still have twice the rate of white babies. Causal factors for the high rates of infant mortality in African Americans include socioeconomic status, racial segregation, and preterm birth. Dominguez points out that in the United States, race and class often go hand in hand, and that racial disparities in health are correlated with socioeconomic inequalities, making socioeconomic status a determinant. Racial segregation is another factor. Segregation makes social and economic mobility difficult and exposes black women and infants to negative stressors. Here we link back to preterm birth. We saw earlier the high rates of infant mortality for black infants due to preterm complications. One study has shown that low-income black mothers who have exposure to racism have twice the risk of very low birth weight babies. We're now going to look at some models that help offer explanations for high rates among black American mothers. We will look at the ecological model, the psychostress model, and end with institutional racism. This graph is taken from an article by Alio et al. In the Maternal and Child Health Journal. These categories offer an explanation for infant mortality. First, infant outcome and characteristics, which are influenced by parental and family characteristics and practices, in turn influenced by community, demographic, and social characteristics. The authors have included a 4th category that shows the historical context of racism that African American mothers have experienced. These all work together to influence infant health outcomes. Next, we have the psychostress model. Environmental stressors the women are exposed to as a result of racism have negative effects on the body. It has been shown that women who had a job with little control yet high demands show an enhanced effect on lower birth weight babies for African American women when compared to white women. To conclude the presentation, we will now look at institutional racism. It is this explanation that encompasses all we've examined in this presentation. Institutional racism has been responsible for the residual effects of racial segregation. These factors have an effect on infant birth weight and overall health. Alio et al. Tells us that poorer birth outcomes of black women when compared to whites and recent black immigrants can be attributed to the internalization of our history of institutionalized racism and individual racism. Infant mortality varies among racial and ethnic groups. However, the largest gap is among African Americans and whites. The number one contributor to the infant mortality rate among African Americans is low birth weight and its associated complications. We examine the causes of low birth weight and some theories used to explain infant mortality rates of African Americans. There is still some ambiguity as to how all factors affect each other and how much each contributes to the disparity of infant mortality. This concludes our look at infant mortality in African American Black women.